Once upon a time, not too long ago, when a patient needed a medical test or procedure, insurance would cover most, if not all, of the cost of what the doctor ordered. If a patient asked, "Doctor, what will this cost?" the doctor could safely say, "Don't worry, your insurance will cover it." Maybe there was a small copay, but with double insurance, say from a spouse's employer and his own, the patient could have almost any medical procedure without spending a dime. All the financial risk was placed squarely on the shoulders of payers. Insurance companies fared quite well as they controlled who they covered with a long list of restrictions. But government payers like Medicare and Medicaid were covering highly vulnerable populations supported by taxes. As healthcare costs continued to skyrocket, insurance companies shifted much of the cost to employers and members by raising premiums, copays, and deductibles. It quickly became unsustainable. Enter Stage Right, the Affordable Care Act. The ACA began to distribute financial risk to providers and the entire U.S. population by requiring insurance for everyone and penalizing those who didn't have coverage. One way some patients have begun assuming part of the risk is to purchase insurance plans with lower monthly premiums, but much higher deductibles. Some plans have deductibles as high as $6,000. So, not only are patients deciding to avoid or postpone some procedures, when they opt for care, they are shopping. With just a few keystrokes and a mouse click, patients can compare the cost of most major medical tests and procedures at facilities in their communities and across the country. Pricing matters like never before, particularly for outpatient procedures. And because patients can also compare infection rates, complications, readmission rates, and outcomes, so does quality. No longer can large health systems and provider networks leverage higher rates simply due to market share or market strength. They must provide value. This access to so many shopping tools creates a new challenge, especially for large providers with a lot of overhead, as they compete with smaller, more financially agile providers. But it also creates new opportunities.